Hi, I'm Dr. T, and I'm a pediatrician. On Ask Dr. T, I answer health questions from teens. Questions ranging from safe sex to self-love to questions about body parts. Let's get this episode started. Alright, these questions are kind of like a vagina grab bag. They mostly have to do with kind of funny or abnormal things noticed in the vagina. So let's get talking about it. Question number 1. What can cause vaginal itch and how do you treat it? So a little vaginal itch can actually be normal, a little every once in a while. But if it's itching a lot, that would be concerning for possibly an infection. The most common itchy cause would be a yeast infection, and that can make things super itchy. But bacterial vaginosis, which is an overgrowth of some bacteria down there, can also cause itch, as can sexually transmitted infections. So if you're having an itch down there and you're worried that there might be an infection, go chat with the doctor. But if it's just a little itch every once in a while, that could be okay. Question number 2. I have what I would describe as a pretty hard ball, kind of at the front opening of my vagina. What could it possibly be? I think it's gotten bigger over time and it's a little uncomfortable moving and sitting up sometimes. So if it's on the inside of the vagina toward the opening, it's very likely what's called a Bartholin gland cyst. So you actually have two little glands at the opening of the vagina that release healthy oils and fluid to lubricate or moisturize the vagina and the vulva, so the surrounding area. Now, these can get plugged up, and it's actually pretty darn common. But when they get plugged up and fluid builds up inside, they can feel like a hard ball or a cyst. And in these situations, as long as it's not super tender or you're not noticing a lot of growth, you can try to open up those glands by bathing or sitting in warm water for 10 to 15 minutes a couple times a day to try to help it open up. If this doesn't work, then you should probably see a doctor, because if that fluid is sitting in there for a long time, it can get infected, it can get tender, which is a bummer. So again, try doing some warm bath sits a couple times a day and see if that helps open things up. And if you don't notice a change or if things get worse, talk to a doctor. Question number 3. I have itchy bumps in my groin area, and they don't really seem to appear right after shaving. They usually show up several days afterward, which makes me wonder if it's something else. What could it be? Well, I actually probably think this is razor burn, so related to shaving, but can take a couple of days to really develop. Little red dots around where you shave and remove the hair. That's probably going to be a little inflammation of the hair follicles. You can apply a low-dose steroid ointment to the area, so like a 1% hydrocortisone, and that can help with some of the itch and the redness, but preventing razor burn can also be helpful. And you do that by, first, when you're shaving, using either a soap or a shaving gel down there, using a fresh razor, and shaving in the direction that hair grows. So don't shave against the hair, shave with the hair. So if you were to run your hand over your hair and it feels smooth, that's the direction you should be shaving. If you feel little pricklies when you're running your hand in the opposite direction, don't shave in that direction. Okay, but those are ways that you can prevent razor burn. And use a little moisturizer after shaving, and that can restore some of the moisture that you shave off while you shave. So, a couple of tips. Question number 4. Hello. So when I try to put a tampon in, it won't go in. I even tried to stick my finger in there and I felt something odd, so I took a mirror and looked down there. I found that inside my vaginal hole I have a whitish pink looking flesh piece. I can't even see the inside of my hole because the flesh is covering it. This is concerning me. So this could be a couple of things, and the reason I'm saying a couple of things is there are some details that make me think it could be one thing or another. So the first one that it could be, if it's inside the vagina, is a Bartholin gland cyst. And that would be a kind of a ball that covers the opening of the vagina. It's reassuring that you've had period blood come out, so we know the hole is there. We know the vagina is there. There's just something that's kind of blocking the opening. So could be a Bartholin gland cyst. The other thing it could be is you might have a bigger hymen, which is okay. We know that there is a hole because you have period blood coming out, but it might make it difficult to put a tampon or a finger in. So what I would recommend doing is talking to a doctor. That way they can take a look and see if it is a hymen issue. They can give you things called dilators that are kind of little plastic pieces that you put in to the vagina, and there are a series of them, so they go from smaller to larger, and it's the whole purpose is to slowly stretch out that hymen without tearing. So that would be what I would recommend for you. It's really all it would take is a doctor taking a peek down there, seeing what it looks like, and then either recommending dilators for you, or if it's a Bartholin gland cyst, doing some soaks in the bathtub. And question number 5. I was sexually abused as a child for years. I am very sorry. Now that I'm older, I feel that my vagina does not get the tingling sensation of feeling turned on. It's like it does not work, and I'm curious as to why and how I can fix this. So, when it comes to sex, there's obviously the physical component, and there's also the mental component. And in order to have a fully satisfying sexual experience, most people find that both of those elements need to be present. If you have not already gone to counseling, I would recommend doing so. This sounds like something that is more on the mental side. And I don't mean mental, I don't mean you're crazy, I mean more that it is something that emotionally needs to be worked through. The good news is that it's very likely with the appropriate counseling and direction, you can get joy from sex and intimacy. And I very much hope that you do. But the first step in all of this is going to be counseling and moving on from that history. And it's horrible, and I'm so sorry you went through that, but know that it can get better, okay? So, and that wraps up my vagina grab bag series. And remember, if you have a question for Ask Dr. T, you can either respond in this video or submit through my website, askdrt.net.